You're listening to Parents You've Got This, the expert guide to parenthood. Your complete guide to pregnancy, birth, baby and parenting. Join us for the journey.
Pregnancy comes with so many pregnancy ailments. There's so many aches and pains that we experience along the way. Today we chat with our obstetrician expert, Dr Peter Jurcevic, about what some of these pregnancy ailments are and how to get some relief.
Dr Peter Jurcevic is an obstetrician and gynaecologist with more than 27 years of experience. He has delivered more than 6,500 babies and he works in both public and private practice. He is also the head of unit and he could not be more well qualified to be able to talk to us about this really relevant topic today.
So Pete, we're going to fire off a whole host of different pregnancy ailments, and if you can talk to us a bit about, what we can do, if anything, to get some relief. The first one I want to talk to you about is probably something that plagues every person that gets pregnant, and that is nausea and vomiting, or morning sickness as they call it.
Sure. So from the moment you conceive, you'll get a surge in a pregnancy hormone beta-HCG, and there's a part of your brain, the hypothalamus, which can sometimes be very sensitive to that hormone, and to a greater or lesser degree you'll feel nauseated as a result of that. For most women that'll be a manageable degree of nausea, and I say that respectfully, and you can manage that by resting, by hydrating yourself, eating small portions, and hopefully just getting through until the end of that first trimester when those pregnancy hormone levels tend to drop off a bit as the placenta kicks in and you start to feel better. Obviously there can be varying extremes of that nausea and vomiting to the point where you can get quite severe hyperemesis, where you're really genuinely sick, not being able to keep any food and fluids down, and occasionally that can lead to some biochemical and personal health concerns. And if that's the case, obviously you'd be speaking with your care provider for some medication support. You can do some basic things as well beyond what I mentioned with sleep and rest and so on. You can try some B6 and ginger supplements. You can get some Restivit, which is an antihistamine, which can sometimes help. Beyond that though, generally speaking, outside of some other holistic things, you'd be looking at prescription medications. So Maxilon, Zofran, and some other type of medications. And occasionally when really quite severe, we can give you some intravenous fluids, either as an acute dose of fluids, just a load, just to break the cycle, or even bring you in for a few days. And in really extreme cases, we can sometimes give you some steroids as well. And obviously everything that we give you medically is safe for you, the baby.
What about indigestion and heartburn, Pete? What are some of the symptoms of these and what can we do to alleviate them? Because they can be quite uncomfortable.
Yeah, very, very common. So the pregnancy hormones in your body have a relaxative effect, and that's a bonus because that's helping the uterus, which is a muscle, grow and not contract, and contract the baby out. We need the baby to be able to grow with the uterus. So with the relaxation that occurs, it doesn't specifically just relax the muscle of the uterus, it can relax other muscles in your body, and dare I say the muscle sphincter, where the food pipe goes down the esophagus into the stomach. If that relaxes, of course, it allows acid to go up. If that's compounded by the baby growing up into the abdomen, pressing on the stomach, you can get reflux or heartburn. And that can manifest as epigastric pain, a burning sensation, nausea, regurgitation to the back of your throat. Women sometimes wake up choking on their own vomit. So if that occurs, we would always suggest avoiding things that would trigger it. So certain foods, and an obvious one would be chili. You would want to try to hydrate well, always try to sleep upright, and maybe smaller portions rather than big portions of food all at once. People sometimes have yogurt, milk, ice cream, dairy. Beyond that though, we can use some medications over the counter, so Rennie's, Quickies, Mylanta, Gaviscon. If that doesn't work, if you speak to your care provider, we can prescribe you with medication. And in a medication such as omeprazole, using it at a low dose and building up can be almost like day and night, like turning off a switch, where it can really make a big difference. So always ask if it's a problem.
Fantastic. And what about varicose veins? Why do we get these, and is there anything we can do about them in pregnancy?
Yeah, so two reasons. One is the relaxative effect of those hormones I've alluded to, which can cause dilation of your veins. And also with the pressure of the uterus growing onto your pelvic vessels, and you're getting increasing back pressure. And if you have a predisposition where the valves in your veins are a little bit weak, you'll get engorgement of the veins and you'll see varicose veins. Now varicose veins can be veins in your legs. You can get varicose veins in the vulva. You can get varicose veins in your bottom, hemorrhoids, okay? They're all varicose veins. And to a greater or lesser degree, they might be visually obvious and sometimes uncomfortable, or both. Now, generally speaking, to be honest, until you're not pregnant, it's very hard for those varicose veins to get better. You have to take the pressure off, you have to release that hormone load. But things that you can try to do are to wear some tight stockings, put your feet up if you can. Not easy for a mother who has other children or is working. And of course, occasionally you can also wear, and I think this is quite useful, some of the SRC shorts specific for pregnancy. And what that does is it helps to bring the uterus a little bit up, and that takes a little bit of pressure off your pelvic vessels. A combination of those things can help.
That leads really well, Pete, into the next one on our list, which is ligament stretching. This can also be really uncomfortable and felt in different places around the body. Can you talk to us a little bit about what's happening and what we can do?
Yeah, so if we focus on ligaments of joints as distinct from the ligaments to the uterus, so we're talking about ligaments in your hips and the ligaments around the pubic area and the ligaments in the back supporting your back joints, even the ligaments around your rib cage. All of these things can soften under the hormonal changes of pregnancy. And when they soften, it means that the support to keep the joint strong and tight is less, and so the joint will shift. It's almost kind of like having arthritis or a version thereof, and with that can become symptoms including pain. So I would usually advocate going to speak to your care provider, but going to see a physio or an osteo or a chiro, depending on what you think. SRC shorts can be very good for stability. There are pelvic belts which can help support your pelvis and your hips. And occasionally, of course, you might need to take some analgesia, and analgesia usually would be generally paracetamol, obviously no anti-inflammatories, as much as anti-inflammatories would be preferred. They're not ideal and safe in pregnancy. For a lot of women, when you get quite crippling joint disease, and I've had women who've ended up on crutches and even women who've ended up in wheelchair in hospitals, it is really just us offering the best support we can, knowing that when the baby is delivered, by whatever means, it will usually improve.
And is that the same thing as pelvic girdle pain, Pete?
So essentially what I was just talking about, yes. If we were talking about ligament pain specific to the uterus, that would be the sort of the ligament pain that comes with the stretching of the ligaments that are attached to the uterus, which of course are stretching as the baby's growing. And that can be manifested as sort of discomfort in the abdomen. And we're very confident a lot of the time that when we get abdominal pain in pregnancy, and we're attuned to premature labour and intrauterine infections or hemorrhage from the placenta, bad pregnancy pains, and then of course other worrisome pains, appendicitis, etc., kidney stones. What we know is that most women who have pain in their tummy in pregnancy, that'll probably be actually ligament stretching, musculoskeletal. But in terms of pelvic girdle pain, that'll be what I spoke to before about that ligament joint sort of softening.
What about restless legs, Pete, and leg pain in pregnancy? Yeah,
so restless legs and leg cramps, very common in pregnancy, very, very common. Leg cramps often respond very nicely to magnesium supplements, either as a powdered formulation with water or as a spray, okay? Ironically, restless legs respond quite well to iron supplementation, so it's always really worthwhile checking someone's iron stores to see where they're at. Anecdotally, I've seen some women where they do a little bit of cold immersion therapy, where they've got restless legs, and they actually sort of hop into a cold bath at night before bed. Anecdotally, that seems to also help things. But always speak to your care provider about those two symptoms.
Maybe it's a good excuse to ask for a leg massage, something like that. Can that be helpful,
try.
Pete?
Of course.
It doesn't hurt.
Good.
Yeah.
And what about the need to frequently go to the toilet? I know, you need to urinate all the time when you're pregnant. Why is this, and is there anything you can do about it?
Sure. If I bored all of you with the old physics formula for capacity, which is volume over pressure, if you've got a small volume and a high pressure, you've got no capacity. If you've got no capacity, you're going to pee all the time. Well, your bladder sits jammed between the pubic bone and the uterus is getting bigger and bigger every day. So it presses on the bladder, no volume, the pressure's increasing, and the formula kicks in, you've got no capacity, so you feel like you need to go all the time, and yet you go and there's nothing coming out. It's also compounded by the fact that your kidneys are filtrating more during pregnancy, so there's more urine that you're wanting to make. Of course, you've got to get that out. So unfortunately, not an easy one to fix until you've had the baby, and very rarely is it ever associated with a urinary tract infection. So 5% of women get a urinary tract infection in pregnancy, and 20% will get a recurring infection if they've had one. So we're always attuned to that possibility. That's why we do a urine screen at the first visit. But for the majority of you, it's just your baby pressing on your bladder.
What about melasma, Pete?
Yep. So melasma is where you get the discoloration on your face, on your breast tissue. You can get linea nigra. It's essentially a discoloration of the skin. So MSH, melanocyte stimulating hormone, increases in pregnancy. Okay, as it increases, parts of your body that are predisposed to becoming hyperpigmented or discoloured can do so. There are certain ethnic groups and demographics where you're more predisposed to that, and there is no way of preventing it, and not much you can do cosmetically beyond covering it up. For most women after the birth, the coloration will change. Some women will always tell you, particularly with the linea nigra, the one up and down the midline where they can see that brown sort of stripe from their belly button. Oh my God, am I going to be stuck with that forever? It's almost, dare I say, a little kind of mark of motherhood. People can say, there's a mum, but a lot of the time it will fade.
And what about that feeling like lightning in the crotch, like a sort of pain?
Yeah, so you've got a gravid uterus, so a uterus with a baby in it that's getting bigger and bigger, and there's weight there, and that's pressing down on your pelvic hammock, but also pressing down onto the nerves. And so as the nerves get pressed on, if you think about the old, you hit your funny bone and get that twang up into your fingers, you can get a similar experience depending on how a baby's placed on some of those nerves that are coming down through your pelvis, and sometimes you can feel that lightning crotch.
What about vaginal discharge, Pete? What's normal in pregnancy and what's not?
Sure. So leukorrhea is the buzzword, and that's the discharge of pregnancy. You are full of hormones. Those hormones cause the glands in the birth canal of the vagina to over-secrete, so you get more secretions. It can be clear, it can be white, yellow, it can even be normal if it's green. Generally speaking, if you are irritated by it, if you think that the odour associated doesn't seem right, if you think you are having too many liners or pads that are becoming sort of stained, you may wish to get it checked by your care provider. Occasionally we'll do a swab. Sometimes we'll find a pathogen. We might find thrush. A lot of the time we'll be reassuring that it's normal. When in doubt, let your care provider know. We would hate to miss something like ruptured membranes, for example.
You mentioned before about, veins, and particularly, hemorrhoids, when we're talking about varicose veins. Is there anything you can do about hemorrhoids? Do they go away when you give birth, or do they get worse?
Yeah, so there is a vascular plexus in the bottom, okay? And again, the pressure, the hormonal changes can cause that plexus to expand, and you can feel a little bubble, a grape, and in severe cases, a really significant amount of hemorrhoid. And for some women that can be quite disabling, it can be quite painful, it can make defecation, going to the bathroom quite painful, and they can sometimes bleed, okay? Generally speaking, what we would encourage you to do is to try to relieve the pressure, so no straining, so keeping your stool loose by dietary approaches or supplements, laxatives. You can also apply some creams to them, and there are some over-the-counter preparations you can get from the pharmacy. Sometimes a maternity pad, slicing the maternity pad, putting an ice block in, covering that over the fabric of the pad and then wedging it up between your butt cheeks, just the soothing application of the ice can help. And even sometimes the SRC shorts I alluded to, where it helps to bring your baby up a little bit, takes the pressure off your pelvic vessels. These are things you can do. Surgically, from a colorectal perspective, you really wouldn't go anywhere near hemorrhoids during pregnancy because the treatments involved in that regard, God forbid you needed that, there is associated with a lot of bleeding, we just wouldn't do it. Most of the time they will improve after the birth, but dare I say, it can take a few months.
Pete, that is wonderful and so reassuring, just really empowering for mums to know that there are things that they can do for these somewhat unpleasant side effects of being pregnant. So thank you so much for sharing your wisdom today with us. And a big thank you to Mustela for sponsoring this episode.
Next week on the podcast, we have Dr. Peter Jurcevic joining us with our midwife and positive birth expert, Narelle Siros, to talk to us all about birth preparation and birth statistics. You've been listening to the Parents You've Got This podcast, the expert guide to parenthood. And never forget, parents, you've got this.
You've been listening to Parents You've Got This, the expert guide to parenthood. You've got this parenting gig